C-section, surgical delivery of your baby. C-section or cesarean section is a surgical procedure that is performed to deliver a baby through incisions made in the mother's abdomen and uterus. This procedure is usually done when vaginal delivery is not possible or when there are complications during pregnancy or labor. In this article we will discuss everything you need to know about C-sections, including the reasons for the procedure, the risks and benefits, the recovery process and more. What is a C-section? A C-section, also known as a cesarean section, is a surgical procedure used to deliver a baby when vaginal delivery is not possible or when it is not safe for the mother or baby. During a C-section, the mother is given anesthesia to numb the lower half of her body. The surgeon then makes an incision in the abdomen and uterus to remove the baby. Reasons for a C-section. There are various reasons why a C-section may be necessary. Some of the common reasons include: labor not progressing. If the mother's cervix is not dilating or if the baby is not descending through the birth canal, a C-section may be necessary. Abnormal fetal position. If the baby is in a breech position, feet or buttocks first, a C-section may be necessary to deliver the baby safely. Fetal distress. If the baby's heart rate drops during labor, a C-section may be necessary to deliver the baby quickly. Multiple pregnancies. If the mother is carrying twins, triplets or more, a C-section may be necessary to ensure the safe delivery of all babies. Placenta previa. If the placenta is covering the cervix, a C-section may be necessary to avoid bleeding and other complications. Previous C-section. If the mother has had a previous C-section, a C-section may be recommended for subsequent pregnancies to avoid the risk of complications during a vaginal birth after C-section, VBAC. Risks and benefits of a C-section. As with any surgical procedure, a C-section comes with risks and benefits. Some of the benefits of a C-section include: safe delivery of the baby. A C-section may be necessary to ensure the safe delivery of the baby and avoid complications. Reduced risk of birth injuries. A C-section may reduce the risk of birth injuries such as shoulder dystocia, especially in large babies. Scheduled delivery. A C-section allows for a scheduled delivery date, which can be convenient for some mothers. Some of the risks of a C-section include: infection. A C-section increases the risk of infection for both the mother and baby. Bleeding. A C-section may cause excessive bleeding, which can be life-threatening in some cases. Longer recovery time. Recovery from a C-section may take longer than recovery from a vaginal birth. Future pregnancies. A C-section may increase the risk of complications in future pregnancies such as placenta previa, uterine rupture and need for repeat C-sections. How to prepare for a C-section. If you are scheduled for a C-section, it is important to prepare yourself both physically and emotionally. Here are some tips to help you prepare. Talk to your healthcare provider. Ask your healthcare provider any questions you may have about the procedure, including the risks and benefits. Arrange for help. You will need help with childcare, housework and other daily activities while you recover from the surgery. Pack your hospital bag. Pack your hospital bag with comfortable clothes, toiletries and other essentials. Follow the instructions provided by your healthcare provider. Your healthcare provider will give you specific instructions on what to eat and drink before the procedure, as well as any medications you. Conclusion. In conclusion, a C-section is a surgical procedure used to deliver a baby when vaginal delivery is not possible or safe. There are various reasons why a C-section may be necessary, including labor not progressing, abnormal fetal position, fetal distress, multiple pregnancies, placenta previa and previous C-section. While a C-section comes with both risks and benefits, it is important for mothers to discuss the procedure with their healthcare provider and prepare themselves both physically and emotionally. With proper preparation and care, mothers can safely deliver their babies through a C-section and recover fully.